welcome to What You Need to Know with Carla Pileggi Caviola. Today on our show, we will be talking about exercise therapy and the Egoscue Method with our special guest and expert, Greg Heinemann. Greg Heinemann is an exercise therapist at the Egoscue Method, primarily located in Westchester County, that's close to New York City. There are over 20 locations in the US currently, and they also treat clients virtually worldwide. It is a true honor to have you on our show today, Greg.
Thank you,
Thank you
Carl.
so much for joining us.
Yeah, thank you for the invite. I appreciate being here and give me the opportunity to share what I'm so passionate about with your audience.
That's amazing. I can't wait to learn from you. And I know you have a lot of great, not just education, but certainly a lot of years of experience. And so you're the perfect person to have on our show. We
Great.
appreciate you taking the time out of your time with your clients to be
Thank
with us.
Yeah, I love to share and love the opportunity to give people this really simple and powerful technique in people's hands and start getting benefit from it sooner rather than later.
I love that. That's beautiful. So, Greg, tell me a little bit about your story. Is it all right if I call you Greg?
Of course.
Yeah, great. I know you have again your personal story, educational background, and again how you got into this line of work as an exercise therapist.
Sure. So I knew nothing about Egoscue, going to school. Like no one goes to school to become an Egoscue posture therapist. I got interested though and very curious about the human body dealing with my own injuries. I had at 14, I broke my leg. I had a femur fracture from playing sports, and wow, amazing! The body healed, and I got better, right? And however, when our body heals a certain way, you get these interesting compensations, which I knew nothing about at the time. All I knew was that my leg felt better. But baseball was my main sport that I really wanted to continue to play, and I enjoyed playing mostly through high school. But by the end, about 4 years later after my injury, I was really having trouble using my arm. I had difficulties throwing a baseball. I had difficulties even driving my car without getting some sort of tingling symptom, even weakness in my right hand while I was
Mhm.
driving. So
Wow.
I decided to I'm interested in how the body works. I want to go to school for this. So I went to Southern Connecticut State University in New Haven, and I studied athletic training with or it was technically it's called exercise science with a concentration in athletic training. And for those of you who don't know, athletic trainers are like if you're watching sports on TV and the big guy gets hurt and the little guys run on the field, we're the little guys running on the
Yeah.
field. So
Yeah.
a lot of my college training was in like emergency care and first aid because you
Oh
may be
wow.
running into like broken bones and all sorts of fun things that happen, when you have injuries playing sports. And then a lot of my rehab techniques I learned were that of a very traditional physical therapist. A lot of stretching and taping and icing and ultrasound machine and all sorts of fun stuff. And I loved it because of the environment that I was in. I was around athletes, around sports. It was really, it was where I kind of wanted to be, or at least I thought I wanted to be at that time in my life. And I very remember distinctly I worked a lot with the men's track team. And we had a couple athletes at the beginning of the year who had these various knee pain, hamstring pull, calf strain, back strain. And the coach was great. And he was very much into, hey, I want you guys to spend all the winter season working on these guys because I need them very much for the spring. And you work with people as often. I work with these guys every day for
Wow.
about 6 weeks, and you start to notice things about like their bodies, and like we'd ask our head trainer, "Hey doc, like this guy's leg, I know his leg really hurts on this side, but why is his other leg crooked? Like why is it bent funny?
Huh.
Or why does
Interesting.
one foot point straight and one foot point out? And why is even one shoulder lower than the other?"
Wow.
And he would just kind of peer around the corner and look at them and say, that's normal for him.
Hmm.
And
Okay.
I didn't know any better, so I just took it as that's normal for him. But sure enough, one by one, as these guys get back out into the spring for season, they all get re-injured, and
Oh
I
wow.
didn't know why, and that left me open for learning more. We'll say that I was not necessarily satisfied with what I had been told, and I didn't felt like it was just kind of incomplete. So I was open to learning something, and the opportunity at the Egoscue Method kind of came just like presented to me, kind of being right place, right time.
Hmm.
And I was very, very much open to learning a different way to think about solving problems and go from there. So that's kind of how I got introduced to Egoscue. So that was
Wow.
October 2003.
It's been a while.
Been a few weeks. Yeah, it's been a few weeks.
Yeah, there you go.
And it's been a joy kind of like seeing the simplicity of the Egoscue idea and the technique, which is why I still love to teach it, and the simplicity of the exercises or the techniques that we teach people. And
Okay.
they're very attainable, they're very easy, and they're extremely effective. They're extremely, extremely good at achieving our goal, which is,
Yeah.
we're, as you may or may not know, Egoscue is the posture. We're a posture company, so we care about posture as a predictive indicator for pain, but also a prescriptive way to people have a solution for whether it's aches or pains, or very much it's more like getting their body back to moving normally. So whether it's like, hey, I want to play professional football, to I want to go for a hike, to I'm a expecting mother going through stages of pregnancy.
Right.
My body, human body is able to handle all these things, but why do I have these things going on? And pain is really there as an indicator. It's supposed to
That's
kind of
right.
make you say, hey, something's not right. Not necessarily always that like you're dying or broken or something, or you're wrong or anything like that. It's more that your body's just asking for help. And we have a unique way to think about the problem, and a very simple solution that people can people can start running with right away.
That's great. Wow. Well, it's definitely a curious, like, I'm very curious to know more about it, even
Sure.
just hearing you speak. Like, if I think, like, even about what you talked about, like, with one athlete with this, leg a little bit crooked, or the foot's out, or the shoulders up or down, like, to me, and again, right? Like, that would just make sense over time. If you leave it like that, it's just going to progressively get worse.
Correct.
I
And
don't know. Is that accurate?
it is in a way, like if you don't like,
Okay.
it's what's the definition of insanity, right? Doing the same thing over and over again, expecting a different result.
Okay. Yeah.
So we're trying to give the body a chance, and we're not necessarily trying to teach it something new or something that it's never known before. We very much believe that when these little kids come out, we have kids the same age, that when they come out, they're perfect. They
Hmm.
got this when they start standing and upright, they got this little belly that sticks out, and their little butt sticks out, and they got these perfectly straight little legs and this little body that wiggles around and stuff like that. And it's so the potential of that body is limitless, right? They can
Yeah.
do anything, and we just, through various things that happen through life, through profession, through injuries, through different sports that we get into, our bodies adapt, and
Yeah.
we adapt to what we do most. A lot of people today sit for a living, so we're really good at sitting. But then we wonder why. Well, I've been sitting for the last 8 hours. Why does it hurt when I go for a walk down the street? Or why does it hurt when
Yeah.
I reach up in the shelf for my favorite cereal? Well,
Or even just neck pain, right? Isn't that like a main symptom of sitting?
yes,
Yeah.
and
Yeah.
especially one-sided. Right? Yeah,
Okay. Okay.
my neck is more tight on one side than the other, or
Interesting.
one-sided low back pain. We saw an explosion of those symptoms show up during COVID.
With pandemic, I was just gonna say, yeah, yeah. So, and this is really important for everyone to know, because nobody wants to be living with pain. And if you have pain, it could potentially get progressively worse, right? And so, really, just trying to nip it in the bud and finding the right posture, the right solution can help you feel better and live a healthier life. But tell me a little bit more about the spectrum of the work that you provide, and of course, really what makes the Egoscue method different than maybe some of the other types of interventions.
Yeah, sure. So Egoscue, as again, as a name, doesn't mean anything. There's no hidden meaning behind
Okay.
Egoscue.
Oh, okay.
We're not trying to skew your ego or anything like that. But um, it is our founder's last name, and
Oh, okay.
and as you said, I'm an exercise therapist, so we only use exercise as our modality. We're not. I'm never physically manipulating someone or moving their body around. I'm really teaching
Okay.
them a technique and some really simple exercises to do with the sole intent of putting the body back in balance. And that we use posture because most people understand the idea of good posture and bad posture. We're not necessarily fans of like you must fake your posture or sit a certain way or stand a certain way. It's more like we think your body has this amazing potential to do it. We just want to awaken it again and give it that chance. So excuse me. We only use posture. We use postures as a way to identify um, how things are off, and if it's logical that wow, if your head's forward or your shoulders up, excuse me, or your body's twisted, that it could put pressure on that one knee because you're standing on one side more than the other.
Right.
And so I wonder what happens if we try to balance your shoulders out. What effect will that have on your knee pain, as an example?
Keep the pressure off. Yep.
And the only thing I'm really an expert on is I know 37 different ways for your body to try to achieve this balance again through movement, through exercise. The exercises are not jumping jacks and push-ups. We're not the six-pack ab program or the burpees to you throw up program.
Okay.
We are very much put things in the right order, in the right working position, restore their normal function, and then go out and do what you love to do. If you love to hike or yoga or Pilates or lift weights or underwater basket weave, like if that's your thing, that will keep you well.
Yeah.
It's just a means to be able to do it to the degree you want to do it. If you want to do yoga every day, great. But it hurts you, it's not yoga's fault that it hurts. It's your fault.
Okay.
In the sense of the body going to this sport or activity doesn't know how to handle it. So we're gonna, make allow you to handle it, and just
Yeah.
by giving your body a chance.
Yeah. Yeah. Right. So having your body in balance, having the right posture can help you to then be able to do the things as long as you don't overextend. Like sometimes I hear people like overextending themselves in classes though, right? Where they're
Sure.
maybe overdoing it. But if you're not, if you're within the normal range, if your body is in correct posture, you should be able to do all these kind of
And
movements, if
and
you will.
and Carla, life happens, right? Like stuff happens. We get in a class environment. We try to, I'm trying to do extra because you're in a class, or
Right.
walk a little too far, and these things happen, and they're unavoidable. So it's more that
Yeah.
in those situations when life happens, if I've done my job correctly, I've given you the tools that you have the peace of mind that you are not at a loss.
Yeah.
Oh, I know what to do. I can do these three exercises that take 4 minutes to do, and you know what? It makes me feel better. How powerful is that? It's just having something in your back pocket that you don't have to run to someone else. You don't got to go start popping Advil. You don't have to start changing your plans because oh, here comes this back pain again. I guess I can't go.
Right.
I can't go hang out with Aunt Sally today because Aunt Sally's going to want to go for a walk, and I can't go for a walk.
Right. And it sounds like I know in your work, Greg, you work with top athletes. I mean, right? I mean, world known top athletes all the way down to like every kind of average person.
Right.
It sounds to me like what you're telling me, though, is that these types of exercises are easy enough that anyone can do it, like the average Joe. It's not like you're going to be,
Correct.
people aren't doing backflips and this and that.
Correct. Yeah, they're very attainable. If you have a chair to sit in, a floor to lie down on, a wall to stand against, you can probably do 85% of the things I would ask. I,
That's amazing.
I would ask.
Yeah. So you don't need like extra equipment or anything like that,
It's,
this or that fancy thing.
this is designed to be self-help at the end of the day. That I'm trying to do
Okay.
something that's pertinent to you and pertinent to your unique either posture or how you function or just the kind of the things that you do, versus that someone else does. Meaning, like, what does my job require? What does my life require? How do I need to be able to do these things with kids of a certain age to be able to keep up with them, or not, whatever your body's looking to do, right? Or at least required to do. So that's all they are. It's just trying to kind of meet you where you're at. Um,
Mhm.
kind
Excellent.
of,
Good. So I know in our podcast, our audience is a lot of parents, people maybe that are actually looking to conceive or, in that journey or, pregnant, expectant moms. and then postpartum parents, right? So again, that's like from delivery through the first year of life, unless of course someone chooses, if they are breastfeeding, to breastfeed beyond that 1 year. So this is kind of a lot of the population that our viewers are falling within. What are the common challenges that you see that maybe pregnant or postpartum moms might experience in, I mean, obviously the body's changing, it's a lot of changes all at once, but how do you see that in your line of work, and how are you best able to help this specific population?
Sure, we see a lot of it. There's a really good book, if I could recommend to you and your audience. It's by our author, our founder, Pete Egoscue. It is called Pain Free for Women. And it's
Can
specifically,
you say that again?
so it's called Pain Free, like pain free, two
Pain
words,
free for women?
for women. Yeah,
Right.
written by Pete Egoscue. And there are sections in the book dedicated to exactly what you're talking about, and kind of from like, all right, from exactly this, like, okay, I think I want to become pregnant or try to become pregnant, to
Right.
year, 2 years, 10 years down the line, and also ideas for your kids to help keep your kids healthy and participating in all these things as you go too. But the biggest thing we'll see in terms of like when I see uh, clients who are somewhere along their journey in that time is exactly like, my body doesn't feel good, and I'm
Right.
nervous. I'm nervous about going through, whether it's I'm nervous about going through delivery, or the pregnancy,
Right.
the birthing process, or I'm nervous afterwards because something happened during pregnancy or at delivery where my body's not right, and now I have to pick up this
Right.
little person and carry them around, and I don't know if my body's able to handle it, kind of stuff like that. So our approach, and kind of what makes us unique that way, is that while symptoms may be similar, there may be a lot of like lower back or sacroiliac joint or pelvic floor or knee pain, stuff like that's associated with it. Um, we know that every body is different, and every body needs a different potential solution for that.
Yes.
So our approach is very unique to you, the individual, on what your body needs. It's not a generic, "Oh, okay, well, your low back hurts. Let me give you the same 6 exercises I give to everyone with low back, irregardless of where you are in your life."
Right. Right.
They're geared to kind of meet you where you're at. Like I said, meet you where you're at and what you can do, with ultimately the goal of like, no, you get to do these things for yourself, and you get to be your own healthcare provider in a way. You have control over how you want to feel, just by spending 10, 15 minutes a day doing some simple things. But a lot of the common misalignment things is that, like, especially during pregnancy, right, you get a lot of the hormones get released, and the body gets really loose, for lack of,
Right. That's right.
and you get the extra weight forward, so it puts a bigger curve in the back, and the pelvis starts to tip forward into, we'll call it an anterior pelvic tilt. And those are all normal things, and some of it beyond our control from a posture sense. My whole deal with that population is like, let's make sure we're doing things evenly. That
Okay.
one side isn't going more than the other, because when it comes time for delivery, um, it's all kind of like straight lines and right angles, and there's a lot of tubes inside. And if the tube is crooked, same thing's going to happen when you pinch the hose outside. Things aren't going to flow that nicely. So
I got
the more we
you.
keep things in balance, the easier of the time is for the mom, for the baby, and kind of for everyone involved in the process. When it's time to get baby out, it's time to get baby out in the most ideal way the body can possibly do it.
That's great. Yeah. That makes sense. So tell me, like, typically treatment, how many times would, I know maybe it's different client to client, but how many times would maybe a person be meeting with you maybe during this time
Yeah,
frame, whether they're pregnant or postpartum? Like, how many sessions would it normally take for them to learn these exercises, this postural, exercises, to then be able to kind of implement it on their own?
sure. So, and I'm a person who starts with me. I would say in an ideal scenario, I'd love to see him once a week for 8 weeks.
Okay.
Go through the process of evaluating your posture, evaluating your function. We're big on shoulders, hips, knees, ankles, and spine. See what parts
Yes.
work, see what parts need some help, and then provide some correction or some exercises with the sole intent of initially putting the body back in balance. So we'll say loosely making it straighter
Yes.
before we make it stronger, because
Okay.
I don't want to strengthen a crooked structure.
That's right. Okay.
For everyone to unpack. In that time frame, clients have homework. So it's like,
Okay.
you're here with me. I'm going to help teach you something. I'll teach you exactly as I expect you to do it at home. But now you go and do your homework. And most people spend anywhere between 10 and 20 minutes, 10 and 15 minutes a day of doing their homework. Um, and the exercises change as their body changes. There are things to it with certain phases of pregnancy that are kind of standard exercises that we give to almost everyone that we cannot do during later phases in pregnancy. Like too much lying on your back is not a great idea.
Right. Right.
That kind of stuff like that. So we just kind of stay away from those kind of things and give them more appropriate exercises as they change and as they go later on. But if someone could get to me earlier in the process, meaning like even potentially before they're thinking about becoming pregnant, and it's not only for a woman, speaking as a man as well too,
Sure.
pelvic alignment's a big deal for the guy if you even want to conceive in the first place.
In regards to fertility.
Right. Because
Okay, well, this is important. We need to have news flash about this, right? Because we're seeing a lot of fertility issues again, right? Like currently
right,
in our society.
right. And it's not like, oh, you can't just blame one party. It takes two to tango here. So
Yes, yes,
there's an even responsibility that if me as a guy, if my body's not working right, how can I expect the result to happen that I want to happen? So there's
right.
just as much value on both sides of the coin to work on your body's function and alignment to make sure, because it's all connected, right? Everything,
Everything is connected, right? One thing affects the other and affects the other.
it's all housed in this one unit. So
That's right.
it's a big deal. We see a lot of stuff that people don't think is related because most people come with like musculoskeletal, like my back hurts or my foot hurts or my knee hurts. But very often we'll get people say, I'm going to the bathroom better. Like, huh? Wonder why that is. Because you're not as twisted. Your body's not as twisted, or you're not as asymmetrical. So your pipes and hoses are can flow a little can flow a little better.
I'm sure everybody would appreciate that, right? If they're feeling a little bit stuck or, like you
Sure.
said, maybe twisted in some way.
Not mentally. I don't deal with mental issues, Carla. Just
Yeah, that's all right. I'll deal
just
with the
physical.
mental part. I'll refer you over for the
Great.
postural
Good.
interventions. But like we said, everything's affected, right? So if
Sure.
people are having pain, it's going to affect their mental health, and everything is connected.
Yeah.
Um,
Unfortunately, we can't separate the head from our rest of our body yet, but give it a few years.
oh boy. Well, this is really important information then for, again, women and men alike about proper posture. And it sounds to me like there's a two-phase treatment. One is getting them in proper posture and then strengthening them. Is that
Right.
right? Okay,
Straighten,
very
straighten,
good.
and in that order: straighten and then strengthen.
Strengthen. Okay, straighten and then strengthen. Perfect. All right. Well, let me ask you this though, Greg. What do you think? I mean, I don't know if a lot of people know what the Egoscue method is, or if they do. Like, would you say there are any barriers that hinder people from seeking out the Egoscue method, postural therapy, exercise therapy, all of this?
Yeah, most of it's just that what you said. They don't. The name doesn't have any real meaning other than like if you know what Egoscue is, if you've been exposed to us in the past. We get still the largest percentage of people who find us are word of mouth referral. This word of mouth
Okay.
who were like, "Oh, I saw these guys for my knee. I know you have a shoulder thing. I wonder if they could help you." Or because we get a lot of very excited and passionate people about doing this. And
Sure.
we're also not for everyone in the sense of like I'm not necessarily like because I'm not a hands-on therapist. If you're not necessarily like the type of person who really you don't necessarily have to enjoy exercise, but can kind of commit to a process of doing something for yourself a day, this won't work for you. This is a do it thing, uh,
Yes.
not where I do it to you. You need to like raise your hand and say, "I'm going to do this for me," um, with a guidance from someone like myself, or a therapist as a coach to kind of help you progress along the way.
So you
Uh,
have to have the motivation,
yeah,
right? You have to have the motivation because if not, you're not going to be able to, do
correct.
anything. And you have to be an active participant. If you're motivated enough, right, then you're going to be willing to do the exercise, like you said, maybe like 10, 20-minute
Right.
homework a day.
Yeah. And
Yeah,
pain is usually a strong enough motivator.
sure.
Some of our problem is, like I said before, I'd love to see you 8 times, like once a week for 8 weeks. A lot of times, people's pain gets better like in 4,
Okay.
and then the motivation wanes. But it's kind of like, when you go to the doctor and you get sick and they give you the pink stuff to drink,
Right.
and you feel better after like 3 days, even though you're supposed to take like 8 or 9 days. Uh,
Yeah.
You're like, I don't need to take this anymore, and then the illness comes back. The same kind of thing. This is one of those things where you have to finish your dose, because even though your body is straighter and feeling better halfway through, you haven't finished your dose. You haven't completed
Sure.
the full process yet of kind of, now we have to keep your body strong and like make sure it can sustain all the things that you want to do with it.
That makes
So
sense.
those are
Yeah.
some of the bigger barriers. We are not a medical company, so we don't accept insurance. That's a draw, a negative draw for some folks. They can't use their insurance.
Mhm.
We're kind of big believers, though, that if you pay attention, and
Okay.
we never turn people away based on their ability to pay. We have so many different options, from, like I mentioned, the pain-free book. There are 5 different Egoscue books out there, all with self-help stuff written within the books for people to go and run with. Many people literally just call us up and say, "Hey, I'm using the book. Which section do I start with?" We'll help them troubleshoot that way.
Oh,
Like,
that's
which is
nice.
great. Like, my objective is to really, you know, give people an opportunity to experience this type of modality for themselves, because I've lived it as going through my own therapy process and sharing it with so many people over the last 21 years, that it's
Mhm.
simple and it's really powerful, and it's just really like, hey, spend a little bit of time for yourself. It'll make all the difference in the world.
Yeah, yeah, that's great. Now, I know you mentioned, so financially, you said you don't turn people away with their, I mean, are there options, payment plans, things like that?
Well, we're pretty flexible.
You're flexible. Okay, that's great
We
to
make
know.
it. We really honestly try to make it work for everyone, and if it doesn't work, we still love you, and we still want to try to find a way to help you in any way we can. And whether that's like, here's a $12 book
Of course, yeah.
versus like, here's a $2,800 course of therapy, right?
Yes,
There's
yes,
there's so many different options for people to kind of
yes.
go.
Now, Greg, I know you mentioned this to me before, but you do have a podcast as well, correct?
Yeah, we do have a on the main Egoscue Method page. We host something monthly on Instagram. So we do a live one that is full of surprises. Typically, though, I bring out one of my other colleagues from across the country. We typically have a topic, like this past month was, which we just did last week, was like traveling for the holidays, and how to keep up with your you've been doing so well so year, but don't let it go now during the holiday.
Right, right.
Some tips for traveling, because sometimes either plane travel or car travel, with the extensive amount of sitting and the different and all the stresses involved with that, is hard for some
Mhm.
people. So some tips and how to handle that. And we always like to give people some little takeaways they can kind of go and grab,
Right.
run with. They can use, whether this is their first exposure to us or they've been with us for years. A lot of people are just, oh yeah, I forgot about that exercise. That used to be
Yes.
one of my favorites. Kind of things like that.
Nice, nice. So, what is that podcast called, or it's just on the Instagram?
Yeah, it's just on our Instagram. It's a live. We do it usually the third Wednesday of every month. It's on our Instagram.
What is the Instagram called?
It's just the Egoscue Method.
The Egoscue method. Okay,
Yeah,
perfect. That makes it simple. So I know that the Egoscue method, from what I understand, is really focusing on those three kind of areas, right? People struggling with pain, discomfort, maybe pain or discomfort, but they're also maybe possibly wanting to prevent injury and then improve performance maybe for other people, right? I think
yeah,
those are the three kind of buckets: pain and discomfort, preventing injury, and then some people are wanting to improve their performance. Like you said, we've got your clients are from age 6 up.
yeah. Pretty much from age 6 to 106.
That's amazing. That's amazing, right? So you really help a lot of people with these three kind of areas, right? Again, pain, preventing injury, and then
Right.
improving their performance. Um, for anyone on this podcast today, this episode, that might be struggling in any one of these sort of areas, or maybe more than one, right? Maybe they're already in pain, but they also want to prevent further injury, or maybe they're wanting to improve performance in some way. It could be one or more areas. Or maybe they have family or friends that might need help in some of these areas. What is your what's your best advice for them today? Like, what are your top tips that you want to leave with them?
Sure. I mean, one way is to even identify if you do have a posture imbalance that may or may not be contributing. Because a lot of people are like, well, I have this thing. I have these painful bunions on my feet, but my mother had painful bunions on her feet.
Oh, okay.
And it's got to be a genetic thing. And while there's certain things with genetics that may be true, there's a reason we think that there could be another reason why your mom had bunions and so do you, because you're moving in with a certain predictable pattern that's creating a different foot strike, and then your body puts the bunion there as a protection. One of the things I love to have people do as a test is, stand up. Stand up. If you have shoes on, preferably take them off, and just stand with your feet together. And if you stand with your feet together and then you close your eyes and kind of just pay attention to what happens. Most people's bodies will move a little bit when they do it. Some people will move more left and right, or they'll feel like, wow, there's a lot more pressure on my right foot than my left foot.
Okay.
Or some people move more forward and backward, like, oh, my toe, all the weights in my toes or all the weights in my heels. Some people will do a circle, and that means they're really in trouble. No, just 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 kidding. But they're all signs of imbalance. And whether you're going left or right or forward or back, there is ideally when you do this, you should stand and kind of be relatively still. If you have proper balanced function of your body. And if you find yourself leaning one way or going forward or back, it's a high chance that your posture is imbalanced, and this imbalance over time has started to put extra pressure, friction, rubbing, tension on an area. And then, oh, why do I have arthritis? But why is my
Oh,
arthritis only on one side?
interesting.
That
Yeah.
that because most people associate arthritis with an aging thing, right?
Mhm.
So is that side older than the other one?
Hmm.
No,
Interesting.
it's
Yeah.
not. It's more like how you're using it, and the function of the body is dictating the result. So one of the things I love to tell people is a lot of people say, "Oh, I'm just getting older," and da 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 da. Your body doesn't know how old it is.
Hmm.
Really and truly, your body does not know how old it is. You know how old you are. So you shape your life and your experiences based on, well, I guess I'm just 52 years old, and these are the things that every 52-year-old does, or whatever, whatever. Um, what your body constantly measures, though, is balance and function. That
Hmm.
if you stand more on your right foot and you're more balanced on your right foot, that's going to dictate how your body functions over time. So the more balanced you are, the better your body works, the higher your metabolism is, the more you can do, irregardless of your age.
I
Right?
love that.
Yeah.
Yeah.
So things to remember. Don't always throw that. I guess I'm just turning a certain age. No, 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 no. Don't let that negative mindset kind of pigeonhole you into reaching your potential.
That's right. I love that. Yeah, there's a lot to do with mindset, like you said. And,
Mhm.
you know, it's important to just constantly be self aware of what's going on in your body, and then being able to, if needed, make tweaks or interventions that are going to help you move towards health and well-being. And really that's what this podcast is all about, for sure. So if anyone would like to reach out, or if anyone is in need of an Egoscue Method provider, they would go to the website, theegoscuemethod.com.
Yep, egoscue.com is the website. You can go search in your location. There's a search bar, or for our locations. We see people not only in person, but half the people I work with I never meet.
Wow.
So because it's a hands-off technique, if I can visually see your posture, assess your movement, get a gauge on what your body's doing, we can provide some simple help.
That's
For
amazing.
sometimes that's actually really nice to see, like a little bit into people's lives, and be like, where can they do these? I know I want this person to do this exercise standing against a wall, but they don't have a wall that doesn't have a picture on it. So
Oh, wow.
how could we pivot and
Yeah.
still still find a way to get it done. So I'm not giving them something that's unattainable.
That's right.
At the end of the day, like I'm teaching self help, so like we have to make it doable for people to be able to advocate for themselves and do something for themselves.
Yes, yes, absolutely. I love that. And I love the fact that distance or location doesn't have to dictate if you can be, treated with the Egoscue method or not. I see that the sun is coming in here. I'm just going to
It's
try
bright.
to block it out.
You're glowing, Carla. You're glowing.
That's amazing. So don't, yeah, for many people, location can be a hindrance, right? Maybe they live in a rural area, they might not have a provider near them, but this is a type of intervention that can help you regardless of where you're at, not just nationally, but globally. And I love that. If
Everywhere.
anybody would like to reach out to you, Greg, in particular, I know you're also very involved with the Egoscue Method for many years and also a co-owner of some of the branches in the New York area. What is the best way to get in touch with you?
Sure. To me directly, it's just my email. It's Greg, Greg, at Egoscue, EGOS, as in Sam, CUE.com. And
Excellent.
send me an email. Just put in the title. I listened to Carlos' podcast. We'd love to help you. We do free consultations for folks. They're about 20 minutes, a half an hour. It's a way for people to ask kind of their maybe more specific questions that they wouldn't want to do in a larger setting and really get a chance to see if this is for them. Um,
Absolutely.
we evaluate your posture. We help you kind of go through the evaluation process just to see if you do have some potential. Yeah, your posture is contributing to your neck, back, knee, migraines, bunions, arthritis, whatever you have going on. And we
Now,
kind of give you a no nonsense, like, nah, we think we could help you or not. There are some situations that we're not appropriate for. Um,
okay.
and we let people know.
And you can make those referrals as needed, I'm sure. Yeah, that's great. Well, please do not evaluate my posture right now because I'm on an angle trying to cover up the sun. But I will definitely be more mindful about my posture as of today. I think it's
But
important for every one of us, especially us who sit in a lot of chairs all day working. It can take a toll on our neck or back or whatever it might be, right? So it's important that we're aware, be able to have the self awareness, and number two, get connected with the right providers so we can start feeling better sooner than later. So
awareness,
Greg,
Carla,
yeah,
awareness is half the battle. Like I'm looking for people to like raise their hand and take an action step. Like it's good to have the information. It's good to be aware, but
yeah,
you can sit in your chair and try to sit up really tall for 2 minutes, and then it gets tired. So we want to make your body be able to do it without too much. I'm thinking about it all the time because then your focus is you're not focused on doing a good job at work. You're focused on trying to sit up, and we want
your
we want
posture.
we want people to be the best at what we want you to be the best at what you're doing. So you can't do that when you're thinking about something all the time. We want your body just to be able to do it, have the potential and the capability to go and do all the things that you love to do the way you want to do them, and just use this as a way to help enable your body to not let you down.
That's great. No, that makes sense because then you can function as you need to during the day, whatever job you're doing or whatever you're doing as a parent, or maybe you're retired, whatever you are, you're able to do what you need to do, but you definitely have your designated time to do your exercises and to continue to.
They're easy, they're simple. There's a lot of free stuff even on YouTube. Look
Excellent.
at
That's amazing.
yeah.
Well, it's been truly amazing to have you on the show today, Greg Heinemann. Once again, expert as an exercise therapist and the Egoscue method. Amazing, a lot of great information, and for us that are motivated, some of us on the viewers today that are motivated, we can take our health to the next level by doing simple exercises, like you said, Greg. Right? Simple exercise that can make a huge difference in our health and quality of life, right? And who doesn't want to be healthy and have a good quality of life? Um, Again, think about the physical health, but emotional and mental health, because everything is connected, right? When we're not feeling great physically, it will take a toll on our mental or emotional health. So once again, Greg, thank you so much for being on the show today. Greg Heinemann, you know where to reach him. The Egoscue Method, GREG at ESC
Egoscue.
Egoscue.com.
Perfect.
Egoscue.com. It's been great having you on the show
Thank
today.
you. I
We
appreciate
appreciate you sharing your expertise and clarity regarding the amazing work you do as an exercise therapist and specialist in the Egoscue Method. Again, GREG at EGOSCUE.com if you'd like to be in touch with Greg Heinemann. Catch him also on his monthly podcast on the Egoscue Method Instagram. And again, if you have found this time to be educational, empowering, and insightful to your health and well-being, please click on the button below to subscribe to my channel. And please feel free to share it at any time with your friends and family and people that also might benefit from today's episode.
Yeah, exactly. Love to share. Thank you, Carla. It's been so much fun. Appreciate your
Thank
time.
you so much, Greg. And thank you all for tuning in today. I look forward to sharing what you need to know next time. Take care and be well.